For my 30 sentences, starting with Chapter 3, the first one, Zach suffers from acne rosacea, so even though he's an adult now, he still has acne along his nose and cheeks. Acne rosacea. 2. Sabrina has anhidrosis. Even after working out for hours, she wouldn't sweat. Anhidrosis. 3. After Tommy deeply burned his hand, he developed a layer of escar on it. Escar. 4. To take the acrylic nails off, Riley onychomacia them to make them soft. Onychomacia. 5. After Sarah noticed red spots on her skin, she went to the doctor, and he told her it was petechiae caused from minor hemorrhaging. Petechiae. 6. Randy had psoriasis on his elbow where he had scaly patches caused from inflammation. Psoriasis. 7. His skin was so hard, he went to the doctor to see why and was told he had scleroderma. Scleroderma. 8. I'm allergic to mayonnaise, and when I eat it, I break out an urticae. Urticae. Urticaal. 9. Mary didn't know what caused her vitiligo, but oftentimes she would lose pigment in her skin and become light. Vitiligo. 10. The student with HPV commonly had verruca that they had removed with laser therapy. Verruca. For Chapter 4, the first sentence, as Brent grew older, his ankylosing spondylitis made him become more stiff in his spinal cord. Ankylosing spondylitis. 2. After Caitlin's ear cartilage tested positive for cancer, the surgeon performed a chondrectomy. 3. After working out for the first time in a while, for 4 hours straight the day before, Thad was having dyskinesia when he moved the next day. Dyskinesia. 4. Bob broke his right arm and couldn't use it for 6 weeks. When he could use it again, he experienced myasthenia. 5. After a really bad muscle tear, Nick had to have the doctor perform a myopathy. 6. The most request the personal trainer got from women was asking him to help them gain myotonia. 7. In the bottom of Harold's femur, they tested for cancer and found osteogenic sarcoma. 8. The patient's tibia was inflamed and caused her to have osteomyelitis. 9. Gary's mother was pseudo-hypertrophic, so he was hoping his muscles would look just as strong. Pseudo-hypertrophic. 10. Kelly's knee had a tumor in the synovial membrane, so they had to perform a synovectomy. For Chapter 5, the first sentence, Gina had an enlarged aneurysm sac that had to be removed. The surgeon told her it was aneurysmectomy, but not to worry. Aneurysmectomy. 2. The blood vessels narrowing caused a decrease in blood flow, so angiostenosis should be taken very seriously. Angiostenosis. 3. After suffering an aneurysm, the patient's arterial wall ruptured, causing an arteriorectus. 4. After receiving their first stethoscopes, the nursing students performed auscultations all day. Auscultations. 5. After discovering the damaged lining of the client's femoral artery, they knew they had to perform an anarthectomy. Anarthectomy. 6. Many people experience orthostatic hypotension when standing up much too quickly. Orthostatic hypotension. 7. The doctors were concerned with the patient's condition after finding many inflamed arteries, meaning she had phlebitis. 8. The heart wasn't getting enough blood because the patient's veins were inflamed and forming blood clots, causing thrombophlebitis. 9. Mike had to have a valvoplasty to repair his heart valve. Valvoplasty. 10. Tori's heart valve was inflamed, so they put her on anti-inflammatories and told her she had valvulitis. And those are my 30 sentences.